Sir, that leads us to another question. When we think about the physical examination, and I have heard many of the homeopaths or even training doctors that, we just sit in the chair and we examine the patient, we ask the questions to the patient. There is no need to touch the patient. How do you think about that?
See, your question is very legitimate. In my practice, so many patients have asked me, "Sir, do you have stethoscope?" I feel like telling them, even I have got the stick. See, we are physicians. We also physically examine the patient. And those who are practicing homeopathy, I will tell practicing homeopaths as well as the students to go through the footnote of paragraph 90. In this footnote, Hahnemann has mentioned that patients should be physically examined. He has mentioned examine the eyes to find out the contractions and dilatations of the pupils. He has mentioned examine the pulse to find out the character of the pulse. He has mentioned examine the skin to find out whether it is dry or moist, cold or hot. Even Hahnemann himself went over the patients and physically examined them. So physical examination is necessary, but one thing every homeopath has to remember, physical examination to find out physical symptoms which are uncommon. We do not prescribe on physical symptoms which are common. We are always searching for physicals, but they are to be uncommon so that they have got prescriptive value. I will tell you one more thing. See, in olden days, every physician used to examine the tongue, irrespective of whether he is practicing homeopathy, allopathy or Ayurveda. Now this examination of the tongue is almost outdated. We don't examine. And that is the reason we have forgotten how the normal tongue looks like. A normal tongue is neither plump nor thin. A normal tongue is slightly moist. It is slightly red. And the normal tongue is clean, or it is slightly white coated. We have forgotten this. Now say for example, in our respiratory symptoms, we have given Antim tart and this patient had white coating on the tongue. Now how to find out whether Antim tart is effective or not? After giving Antim tart, in the follow-up visit, examine the tongue. If this white coating has disappeared or it is disappearing, meaning Antim tart is effective. So physical examination also helps us to judge not only the drug, it also helps us to find out whether my prescription is effective or not. One more example I will give you. See, it's a psychology of most of the Indian patients. Anything in abdomen, say little pain in abdomen, he would come and say, "Sir, stomach pain." So any pain between diaphragm and the pelvic floor is described as the stomach pain. But this stomach pain may not be the stomach pain, it may be the pain of appendix. It may be the pain of gallstones. And how are we going to proceed if we don't physically examine the patient? We have to find out whether this pain is related with appendix or gallstone or intestine. So physical examination is required even for a homeopathic doctor to find out the prescription.
Thank you, sir.